Hi everybody and welcome to our module on renal anatomy. In terms of gross anatomy, I think of the kidneys as having three major portions. The first major portion is this outer section, that's called the cortex. The next innermost portion is called the medulla, and the medulla is made up of structures that look like pyramids, and they are called obviously the medullary pyramids. And then inside of the medulla you can find the third major portion of the kidney, and that's the collecting system shown in yellow in this picture on the screen. At the medical student level, what's very important for you to know in terms of gross anatomy is where you can find the different parts of the nephron in the gross structure of the kidney. So let's talk about that now. In the cortex, the outermost part of the kidney, that's where you find nephron structures like the glomeruli, the proximal tubule, and the distal tubule. In the medulla, the middle portion of the kidney, that's where you find nephron structures like the loop of Henle and the collecting duct. In fact, the medullary pyramids are made up by parts of nephrons running next to each other in the medulla. It's also important as a medical student that you know some of the names associated with the collecting system. So a calyx is this portion here I'm highlighting with my pen. It collects urine coming from the medullary pyramids. We call the place where the medullary pyramids meet the renal calyces the papilla, so that's the renal papilla. And then finally, the pelvis is this section in the middle that is collecting urine coming from all the medullary pyramids. And then finally, you should also know that the artery that delivers blood flow to the kidney is called the renal artery, and the vein that drains blood from the kidney is called the renal vein. Here's another picture just to make these structures more clear in your mind. The renal cortex is the outermost section of the kidney. Inside of the cortex you find the medulla, which contains the renal pyramids. Where the pyramids meet the collecting system, that's called the renal papilla. And then finally you have minor calyces, which collect urine from a single medullary pyramid, and major calyces, which collect urine from multiple minor calyces. They all drain into the renal pelvis, which leads to the ureter and goes to the bladder. Let's talk about the arterial system of blood that supplies the kidneys. The renal artery that we mentioned on the last slide comes off the aorta. It then branches progressively into a series of smaller vessels, first into the segmental arteries, then into the interlobar arteries, then into the arcuate arteries, and finally into vessels called interlobular arteries, and these are the vessels that supply blood to the glomeruli of the nephrons. The flow of blood into and out of the glomerular capillaries is very unusual, and it's very important that you understand this as a medical student. In most systems in the body, blood flows into arteries that branch down into arterioles. Those feed capillaries, and from there blood flows into venules and veins. The system in the kidneys is different. That interlobular artery that I mentioned on the last slide feeds a set of afferent arterioles that deliver blood to the glomerular capillaries. After the glomerular capillaries, however, there is not a venule. There is a second arteriole called the efferent arteriole. This allows the body to control blood flow into and out of the glomerular capillaries through two mechanisms. Vasoconstriction can occur in the afferent arteriole, but also in the efferent arteriole, and this has a number of important physiological effects that I'll talk about in other modules. After the efferent arteriole, blood flows into a set of peritubular capillaries, and from here, blood flows into veins as you would expect for a normal system. But the kidneys are unique in that they have two arterioles, the afferent and the efferent. There are a couple of special features of the left and right kidney you should be aware of. The right kidney is slightly smaller compared to the left. That's because there is less development of the right kidney in utero due to the presence of the liver. In addition, the left kidney has a longer renal vein compared to the right. If you look at this picture on the bottom of the screen, the left renal vein has to cross the aorta. For this reason, it is longer than the right renal vein, and this is one of the reasons that the left kidney is often the kidney that's taken for transplantation. In addition, you may not know this, I didn't know this as a medical student, but the dead or dying kidneys are usually not removed in a transplant operation. That's because to take them out of the retroperitoneum would increase the risk of the operation. For that reason, they are left behind, and the new kidney needs a new place to be attached, so it's usually attached to the iliac artery and vein. And you can actually palpate this in the abdomen of patients who've had a kidney transplant. Because the renal arteries come off the abdominal aorta, blood flow to the kidneys can potentially be disrupted in aortic dissection. I talk about aortic dissection in detail in a video in the cardiology section, but for our purposes here, I'll just remind you that in this condition, there is a tear in the intima of the aorta, and blood can get into the space between the intima and the media and dissect that plane. This can disrupt the flow of blood to vessels that come off the aorta, and if the dissection goes all the way down into the abdomen and disrupts flow through the blood vessels that come off the aorta in the abdomen, that can potentially cause renal ischemia. And that concludes our module on renal anatomy.